All right. Well, welcome everybody. This is, I guess, our final episode. April has been really exciting and a lot of, spreading awareness about the importance and impact of organ donation. Of course, that's every day, all day for our community. And it's also about really honoring our donors and donor families because if anybody knows me, I always say without them, I have no story, and none of us do. So it's nice to be able to dedicate this last episode to to support the families and the donor families. So thank you, Amy, and I'll let you take it from there.
Thanks, Kathleen. So yeah, today we're just you know talking about support for donor families. Just kind of dive right in here. So thanks a lot for watching later on, or thanks for being here today. So just wanted to start by acknowledging that this is a space for donor families that matters because your experience is very unique and it really sits at an intersection of sudden loss and trauma and meaning making in a way that's very different from other kinds of loss. So before we begin, I just want to say that there's no expectation in this, you know, hour or 45 minutes here for you to stay strong. There's no expectation for you to feel grateful, and no expectation to make sense of anything really. Your journey is yours and it's unique, and you're just allowed to simply be here. If at any point you want to take a break. You can turn your camera off or step away or just listen. Being recorded, so you can always go back and watch this in segments if you need. So just kind of pay attention to your body and allow your brain and your nervous system here to set the pace for you. All right, so our question, I guess, for today, or our focus today is just donor families living with loss while carrying your loved one's legacy forward. So, we're not talking about replacing or resolving loss, but learning how both uh, kind of carrying your loved one's legacy and dealing with loss can coexist. Donor families often experience something that is very human, but also very complex. So there's grief and shock and love and meaning, and it's all happening kind of at once. So many donor families kind of experience your experience is kind of losing someone suddenly and then being asked to make a decision about organ donation. Um, you're also navigating a medical system while you're in crisis. And then, kind of, once it's all done, you're just kind of out of that system and everything's kind of changed. So, just want to validate that that's not a small experience. It's a traumatic experience layered with grief. And often, sometimes the support that follows doesn't necessarily match the intensity of what you experienced. So there are some common needs that show up in donor families. So once again, just feeling that grief, but also pride and like the life that you lost, there's meaning behind it, but there's also confusion. So that might leave people feeling really proud of the donation part, but also shattered by the loss that you've experienced. Um, so you might feel moments of connection, but also still going through that grieving process, you might feel moments of anger, deep sadness. You might notice guilt for not always feeling grateful as well. So those are not contradictions, those are coexisting they're emotional truths that are existing together. And, there's just something to kind of wrap your head around here is that your system is capable of holding multiple emotions all at once, even when they feel like they don't necessarily belong together. So, really thinking about here how you can have these contradicting feelings happening at the same time. So, two things can be true at once. All right. So, so one of the more difficult parts of being a donor family is that external pressure that can show up. So the pressure here, what I'm talking about is that focus on the lives saved, maybe for you to see meaning before you're ready, or a pressure to be strong or grateful. And sometimes that pressure it's not spoken, right? It's felt. And what happens is that your own grief or that grief process can start to feel like it needs to shrink a little bit in order to make space for the story that other people understand. But, in reality here, your loss does not become smaller because something meaningful came from it. Once again, both those things exist at the same time. Um, So another important piece is that the grief inside of your family system, it doesn't always look the same, right? So sibling, partners, parents, everyone's kind of processing very differently. Um, like for example, some siblings there, you might carry more of a silent grief or confusion about what your role might be there. You're not the one making that decision. Well, sometimes you are, but for the most part, not. But there's some confusion about your role. And there's a sense of being a little bit secondary to a loss if your sibling had passed away. Um, but your experience is just as real as everyone's. And just want to validate here that there's no hierarchy in grief. There's only expression of grief. Okay, so trauma and the body. So here we're talking about sudden loss. When loss is sudden, the experience isn't only emotional, it's also physiological. So your body is registering shock, urgency, fear, and overwhelm. And sometimes those responses don't fully resolve or process through. And that's where we refer to trauma stored in the body or in the nervous system. And that can show up as feeling stuck even years later, intense reactions to reminders, emotional flooding or shutdown, difficulty feeling safe or grounded. And here, I just want you to understand that that's not because there's something wrong with you. It's because your nervous system is doing exactly what it's designed to do. It's protecting you from that overwhelming moment. And we're going to talk about this a little later in the presentation here, but that that protection, it comes up in a lot of different ways. And yeah, I'll talk about that in a minute. But it can really kind of pop up and kind of overwhelm your system at times when you're not expecting. So it's definitely maybe some that you are expecting, like that milestone of loss or anniversary trauma. Dates are also like significant. Seasons, you have this unconscious awareness inside of your body of different seasons. So sometimes when you've experienced that traumatic loss and it's coming upon the season of that loss, your body can be responding to something that you might not consciously be aware of. Um, But just reminding yourself here that your nervous system is just activating because you have memories stored in your body. And it's not because you're going backwards here, it's just because your body remembers. And grief is not just something that we think about, it's something that we carry physically and emotionally and neurologically. Okay, so when we're talking about donor families, there's often a question that arises around a connection with recipients. Um, so some families feel a deep desire for that those connections, but other people feel unsure or hesitant and sometimes overwhelmed, but both are valid. So readiness for connection, um, you can look at that as a moral decision or a thought-based decisions, but it's also a nervous system or body readiness decision. So it can depend on where you are in your grief, what feels safe emotionally, and what meaning you're still making of that loss. And so there is no right timeline of that connection if or when you want to make it. There's no requirement to engage with those connections before you're ready, or even at all if that's what you decide. So, another important piece is how to carry your loved one forward. Legacy here, it doesn't mean moving on. It doesn't mean letting go. It means finding ways for your relationship to continue in a different form with the person that you've lost. So that could look like talking about them, living in ways that reflect their value, creating rituals or traditions, or just simply just some quiet internal connections. Um, Grief, it often shifts over time. And what you're looking for there is like an enduring connection. It's not about the absence, but it's about transformation. And, getting support through that process there, or just advice, or just neutral support there, it can be really important, right? So not all support in that is the same. There are times when just that grief support is helpful, and that can include like talking about your loved one, processing those emotions, and just having that experience witnessed. And then there are times when there's a need for more trauma focused support or therapy. And that piece is important when your body feels stuck, when your reactions are feeling really intense or they're very unpredictable. Um, or, after a period of time, that experience, it still feels very present, rather than in the past. You might experience some flashbacks, for example, or feel like you're really reliving that. And that's where trauma therapy helps. It helps your nervous system process what wasn't able to be processed at the time. So your memories are made with thoughts, images, associated memories, emotions, and body sensations. Okay. And they're kind of there. And for the most part, we always do this great job. Our brain does this awesome work, and our body does this awesome work at um, kind of taking an experience at a certain point and integrating it with some adaptive information. But sometimes your memories can be stored in like a trauma memory, and it doesn't necessarily get processed through. Even though your brain and your body, it has a lot of adaptive information to attach, there's a block there, and that could be being blocked by, big emotions, or once again, like an image or other memories associated with this. So when you're noticing like that stuckness there of that memory network, that can be a time where you're thinking about maybe looking at more intense trauma focused care. Um, so just a brief overview there. Some approaches that are helpful are EMDR, which helps your brain reprocess distressing experience so they feel less overwhelming. So you still remember them, but they don't come up with such intense body sensations or intense emotions or images that flash. Um, you can also do cognitive approaches like cognitive behavior therapy, and those work with your thought patterns, any guilt cycles, and it also helps with meaning making. And then there's a lot of somatic or body-based therapies, and they focus on how this trauma is being stored in your body, and it helps you to understand maybe better how to regulate your nervous system and your body sensations. But often, healing from the more traumatic responses here, it's going to involve all three layers of thinking, feeling, and the body. So just some psych ed there for if you're looking for some support, a little more professional support there. Okay, so yes, grief is not linear. So we all know the stages of grief. They're very, very common. I'm going to get to that in a moment, but what I kind of talk to donor families about is really these tasks of mourning. Okay. And it's not about getting over the loss, it's about engaging in these tasks that help us adapt to a world that is now changed. So these tasks, they're not stages and they don't happen in order. People move back and forth and up and down all around. And they move through them over time. So for donor families, each task carries this unique complexity. So if you're thinking about one of the tasks is accepting. So you're really thinking about here is accepting the reality of the loss. So after a sudden death, especially in the hospital setting involving a neurological death, life support or organ donation, accepting the reality of death can be more complicated. Many donor families describe a little bit of confusion here because your loved one doesn't appear deceased. They're physically warm, breathing with machine help, or medically sustained while those donation decisions are being made. So it can create this a little bit of emotional dissonance where they look alive. Um, you kind of know what the doctor is saying, but your body doesn't really understand it. You might have a thought there about, I can still hold their hand. It doesn't feel complete. So for some families, donations, it offers meaning. But I just want to validate the opposite of that too, that for others, the procedure and the nature of that donation it can just intensify disbelief. And so just kind of being gentle here with yourself and understanding that accepting it often will happen in those layers again that before you emotionally understand or physiologically understand. Your mind knows, you know what you're doing, but you don't feel like that in your body. The body takes a little bit longer to accept what the mind has been told. Okay. And then in another task is processing. And really, what you're thinking about here is this task of processing pain of loss or grief. So, donor families, there's a lot of forms of pain. You got the emotional pain, there's traumatic shock, a lot of distress. There can be medical trauma here, survivor's guilt, um, and secondary losses. And families often might struggle with just like, you know, the images from ICU, the emergency of it all, the emergency decision making that has to happen, the the process of organ donation and, that being kind of figured out and managed, feeling responsible, or just feeling really awkward in the public praise that can sometimes happen. And it feels just really misaligned with your own private emotional like suffering that you're experiencing. So, sometimes it can really, a donor family or you can feel pressure to focus on recipients or the gift that you're giving others. And it might lead to suppressing your own feelings or your own devastation of loss. But grief requires that pain to be acknowledged and not bypassed, right? So your healing involves understanding and allowing and giving permission to feel for yourself to feel sadness, rage, numb, pride, relief, and to be confused about all of it. And all those emotions, all the emotional states there, they're a part of mourning. All right. Another task would be adjusting to this world that you have to live in without the person that you love. So that task, it can be a little more painful, because you're adapting to not only to absence, but also to this enduring presence of a legacy that your loved one has left behind. Um, so of course you're going to have those practical changes like family roles and parenting, identity changes, ritual changes, but there's emotional changes as well. Might like some questions that might come up are who am I now? How do I carry this story with me? And how do I honor them um, while surviving this pain? Um, for donor families, you might have to also then navigate correspondence, from donation organizations. You're thinking about that potential recipient contact, um, that public recognition as well. And sometimes there's even advocacy roles that a lot of people find themselves taking on. Um, some people really heal in those spaces, and others find them overwhelming. So there's no singular correct path there. Um, and then we're that final, or well, another task is looking for that enduring connection. Um, so once again, you're not moving on from all of that. This actually happened, so it's always going to be with you. It But what you're going to be doing here is learning how to maintain connection while continuing life. And once again, for donor families, lots of different ways for you to kind of think about how to create that enduring connection. Storytelling, your own private remembrance, maybe it is corresponding with recipients, or, doing a project, a legacy project. A lot of people do that. Yeah, creating new rituals, things like that. Um, but I just want to validate here that the donation piece, it's not meant to erase grief. Your loved one's life was not only meaningful because of donation, their life mattered first, and that's really important. All right. Okay, stages of grief. So this is like the old school kind of like everyone knows these stages of grief, okay? So they're denial, anger, bargaining, depression, acceptance. They're widely recognized, but they're often really misunderstood as like you're going through this like checklist. But they are not sequential. They don't follow a specific pattern. Um, they are not universal either. You don't have to feel all those things in order to, I don't know, feel better, I guess. So there's a little bit of a myths going on with that kind of stages of grief thing. All right. So you might find yourself here cycling repeatedly through multiple emotional states. And it doesn't mean that you're failing one or going backwards. It like there is no, it's not a checklist. I felt this, so now I can get ready and feel this, and now I can get ready and feel that. That's really not the way it works. All right. So for um, donor families, I'll just go through them here. So denial, you've experienced sudden loss and you've had to make this decision. There's a lot of confusing feelings. You got all these things going on here and you're in crisis for a lot of it. Um, your denial here might look like emotional numbness, difficulty comprehending death, just the shock around the whole thing. Um, and you might use avoidance here of discussing loss because it feels protective, like you don't want to necessarily get into that. All right. Anger might pop up. You might have anger directed at a medical system or the circumstances of the death of your loved one. You might have anger toward yourself or others, or just like that general unfairness of loss. um, in organ donation, there might have been a communication breakdown that you could feel a little angry about, the timing of discussions, perceived insensitivity, or, just that lack of long-term support. Um, so keeping in mind through all of this here, you are in a different state after sudden loss or loss in general. You're in a different state. So even if someone is trying their best inside of this system to be very sensitive, you might not be reading that properly because you're in those more mobilized or immobilized states of survival. You're further away from empathy, connection, language skills, understanding, learning. You're further away from all those abilities. You're kind of in those different states of survival because this feels very painful. So that anger is kind of something that might come up later on. So bargaining, this is when you're asking questions or you're replaying your decisions. You're questioning your own choices that you made, maybe medical choices or other choices. And you're wondering and you're going through all these different scenarios of if something different could have happened to change this outcome. And this can be especially intense after a sudden loss or loss in general, like just in the months following. Bargaining can be particularly intense where you're going through those different scenarios of what ifs. Depression is something you might experience. So that's some deep sadness, deep exhaustion, emotional collapse, and maybe even the loss of your own identity, feeling a little dissociated there. And that can be compounded by trauma symptoms. So you can kind of just be aware of that and be very, understanding of yourself, reach out, ask for help. And then another stage is acceptance. So I really like accepting over acceptance. Acceptance feels like I did it. But really, this is a process of accepting, and it's a lifelong kind of journey of accepting a loss. Like things come up over and over again in life where you wish that you would have that person there with you. So it doesn't mean that you're okay now. Accepting it means integrating this reality over time. And even as you're kind of doing that, all those other things that I just talked about, they might reemerge, and you're kind of managing that inside of those moments. Okay. All right, so complicated grief and ambiguous loss. Donor families actually have a 50% higher chance of experiencing complicated grief. So like I said, grief is not following these expected trajectories. Okay. So complicated grief is persistent, intense grief, and it feels ongoing. It feels like it's impairing you or that you're frozen or stuck. Um, and though complicated grief, it can be worsened by traumatic death, medical trauma, unresolved questions, lack of support, and suppressed emotions. Okay. Now, complicated grief is more common when you've had ambiguous loss. So, ambiguous loss, it often occurs when there's closure that feels slightly incomplete. So, examples in donor families, it might be difficulty um, coming to terms with or wrapping your mind around that physical appearance of your loved one being breathing and warm, and but you know that their brain is not working. Um, there can be emotional complexity around the organ donation in general. There can be ongoing thoughts about recipients and questions about identity. Again, there and like what happened to the body and like how to create this legacy moving forward. Um, so you're ultimately feeling here that your loved one is gone, but parts of them are continuing, and that can complicate mourning sometimes. Okay, so the medical system, um, you know, you're also involved in a medical system, and it can be so different. That experience can be so different for so many people. So it can be really healing, or it can be harmful in different ways. So that system, it can shape your outcome. So for some families, that system feels very compassionate. There's clear communication, gentle pacing, emotional validation, excuse me, and just really respectful conversations and discussions. And those conversations, they really reduce trauma severity. Okay. For others, the experience might feel rushed or procedural. It can feel cold, confusing, or really intense. So that might be, once again, your body's experiencing that, like your perception is experiencing that, or it can be true, like that is the way it felt. So I just want to really kind of validate that, those experiences within that medical system can vary. And that variability kind of matters in your experience. All right. Um, so when you're looking for support here, um, you you kind of want to think about trauma informed healing. All right. So donor loss, once again, it includes grief and trauma. So support often requires more than traditional bereavement. And that healing, it can include grief support, trauma therapy, and family systems work. Okay. Switch the slide here. Um, so the grief support there, it can just be like that traditional bereavement where you're meaning making emotional validation and really kind of gathering that community around you. Trauma therapy, it's different. Sometimes what's really important to understand is that you witnessed a loved one suffering, and that really activates similar neural networks in your own direct trauma exposure. So we co-regulate with the ones that we love very, very intensely. So that powerlessness there, it's a key trauma ingredients. And what you might have experience there in your mind is like, well, it's not happening to me, but sometimes your body doesn't make that distinction and your nervous system, it starts to adapt to that threat too. You're witnessing it and it feels like this is happening to me. Like you're feeling you're kind of you're with that loved one there. You're really feeling it for them. And over time, that can create this baseline of like you experienced that trauma there as well. Once again, the brain not maybe sometimes being able to distinguish between someone you really care for and you're always co-regulating with, whether it's happening to you or them. Excuse me. So really thinking about once again if you're noticing that or if you remember like that experience, you might want to look for some trauma focused therapy like the EMDR, somatic therapy, nervous system regulation, and even think about doing some medical trauma reprocessing yourself. All right. Once again, that trauma, it just feels, if it felt real to you, then that's valid. It felt real to you. So you might need to do some of that reprocessing on your own there as well. Um, you can think about healing in a family kind of way. So noticing mutual silence that occurs after loss, especially after sudden loss. It's when those there's a mutual silence when emotions are filtered or minimized, and you kind of avoid talking about that what happened. Your conversations become a little more practical and instead of emotional, and you really guard against the emotion. And sometimes your nervous system can interpret that as I'm alone in these emotions. Um, and trauma really heals in connection with others. So sometimes when we can't speak the experience, your body will continue to carry it. Um, what makes this mutual silence maybe curious or interesting is that families often are very physically close during loss. They're with each other, they attend to each other, but they want to protect each other. And when there's, fear, grief, anger, exhaustion, and they're not named, sometimes each person believes that they're the only one struggling. So that can increase self-blame or emotional withdrawal. And it can really reinforce trauma loops. And that's kind of when this unspoken pain remains physiologically active. So, your brain is continuing to scan and you're very stressed still and there's a lot of hypervigilance, there's a lot of very jumpy, you're kind of jumpy and things like that. And it's because your brain and your body, it's not receiving that information or input or that adaptive information that you're okay, that you've survived this loss and that you're not alone. Excuse me. Yeah. So you need to process relationally. And that protection, that mutual silence, so that feels like protecting each other. It's not failing. It's very protective, but at a certain point, that connection and that talking about it and that emotional regulation with each other, it becomes a pathway to healing. And it doesn't mean overwhelming each other. It just means gradually allowing a shared truth to emerge. And, um, you might want to just start with simple statements like, I was really scared, or I was feeling a lot of pain there. And, having those conversations with family, it can really help regulate that psychological and physiological load that feels really heavy on people. Um, so you might want to think about some family therapy, um, just to support everyone that has gone through a similar experience. Um, there could be couples work there, or even just allowing some space in these different environments, like when you're all together, if sometimes feels like, oh, I don't want to bring it up. I feel like the emotion rising, but I'm just gonna like shove that down. I'm not gonna bring it up because this is supposed to be a joyful time. You can start to kind of talk about that, and you need to, because that's where a lot of the healing happens, right? So once again, you're really thinking about integrating everyone's experience. And donor families, you deserve care that recognizes your full reality of the journey, right? Not just gifts, the gift of life or the recipients or the public story, but also your trauma that you experienced, your shock, the grief, what you're carrying, what feels heavy. Those are all valid things to explore as well. And just keeping in mind here that grief, once again, it's not moving in straight lines, and healing for everyone will look different. So within that family there, um, healing might not look how others expect. And you have to allow that to be okay. Um, Once again, that loss really matters. Your loved one matters. And you need to give that permission within that family to speak some of that out. All right. So, as we bring this all together, just thinking about here, donor families, you're often asked directly or indirectly to carry this narrative that might not include or reflect your entire experience there. So really, I want you to think about expanding that narrative. You're allowed to feel all the things at once. So grief and pride, love and anger, connection and distance, meaning and confusion. You can feel all these things at once. um, Healing is not about choosing one feeling over the other. It's about making space for all of them. Emotions, there's no good and no bad. They're just there for us. All humans experience the full range of emotion, and all of our emotions, they're telling us something. They're communicating something to us. So we want to allow space for all of them to be and exist. And, this is kind of why you deserve this ongoing care, ongoing conversation, or, with professionals or with friends or families or other people in your life. Um, it's not just about that immediate aftermath. It's in the months and the years that follow. It's not something you're necessarily going to get over or let go of. It's something that you're learning to carry with you, and how you carry it, it's really personal and it's unique to you. Um, Once again, not going to go through any check boxes here. It's kind of back and forth all around. Um, and you have to allow yourself and give yourself permission to feel some of those more difficult feelings. And if you need help with feeling those, you don't feel like you're able to do it, ask for support from family or, a professional. Um, because those over time, you're going to see that those emotions or that processing really changes over time. And wherever you're at in your journey here, you don't have to force a meaning from things. You don't have to rush any kind of healing. And you certainly want to start to understand that you don't have to do things alone. You can work with other people. You can share things with your families. You don't have to protect everyone. um, you want to kind of include other people and heal relationally, heal, be witnessed, um, do some trauma processing and desensitization, and know that you're not alone. So I really thank you for being here, and I want to thank Kathleen for putting this all out, and giving the opportunity for these things to be recorded and posted somewhere where people can access them freely. So thanks a lot, Kathleen, for getting this all together. And I appreciate everyone that's watched. All There's multiple episodes in this series, but watching this episode, watching the past episodes. So I just want to thank you all for being there and being courageous on your journeys.
Awesome. And thank you, Amy, too, for your time and expertise and your passion. So really appreciate it.
Yeah, awesome. Okay, I'm going to stop sharing, just open up any questions. Oh, going to stop recording.